I'm delighted to introduce our next speaker, Dr. Sunita Maheshwari. Dr. Sunita is a renowned pediatric cardiologist and is the chief dreamer at the Telrad Group. Her passion to bring telemedicine and teleradiology to remote areas of the nation is infectious, pun intended. Dr. Sunita, over to you.
Doctor, but here today to talk about how advancements in technology and tech really have been benefiting the healthcare industry. I'll start with, has anything changed when we look at the medical education? But before that, if you look at how tech is enabling healthcare and really what that enablement is doing, one is patients are able to today access medical care from home as well as remote areas. So tech is improving ease, it's reducing travel costs. Patients and doctors are able to get diagnostic test results. So tech is improving the quality of decision making in medical care. Doctors are able to access other doctors. So that's improving patient outcomes. And there's self-monitoring. So that's improving prevention. So I think tech has already in the last couple of years shown that it can enable and improve healthcare. And things have really dramatically changed in this space, I would say, in the last 2 years especially, and I'll show you why. But definitely things have been evolving over the last decade. Now, if you look at medical education, so this is 30 years ago, me on the left at JIPMER in Pondicherry. This is 30 years later, my daughter at JIPMER, first year MBBS when she joined. And I asked myself, has anything changed? Because she described her first day being in the dissection hall with formalin and the body popping out of formalin and all the medical students around it, which is something that happened 30 years ago when I was a med student. So when I trained as a medical student, I had real bones. I mean, those real bones were under my bed and I would play with them and look at the tibia and the fibula. And today there's 3D printed anatomy and artificial bones. No human bones under our beds anymore. In my day, this is how it looked. You had these massive books on your desk and you were poring over it with a little torchlight if the electricity went off. I think today you've got smartphones, smart students on their smartphones taking notes, it's all much. They've got app-based education in the sense of quizzes on the phone and so many things that they can do while they're just wandering around town. In my time, we practiced on live patients. So most of the training in India was at government hospitals. You had live patients. You were practicing everything from IV lines to intubation to surgery. Today, you've got surgical simulation labs, medical simulation labs, cardiac catheterization simulation labs. And even in India, there's several simulation labs where doctors, anesthetists, paramedics, everybody trains on procedures before actually going on to a live patient. And all these simulation labs have only been possible because of advances in medtech. Now, when you look at teaching, I mean, look at today, right? We're on Teams and we're attending a NASCOM session. And we all know that COVID has enabled a lot of the Zoom lectures and we're all zoomed out. But even pre-COVID, tech-enabled e-teaching has been ongoing in the medical field really for the last 10 years in India. And the biggest advantage has been that there is a shortage of trainers, there's a shortage of teachers. So if you take one specialist, let's say a pediatric cardiologist or a cardiologist, the students can be anywhere. They can be across 10 universities, 20 universities, 30 hospitals. So one teacher and students all over. So one teacher to all postgraduates. And the bigger advantage we have found in medical education is that the same content is going to all the centers. So, if you were training in one hospital that, give Brufen in this situation and another hospital was saying something else, today it's all standardized because we're using tech-enabled e-teaching. So I'll move on from there to, tech in healthcare. So the medical education bit you can see has already been transformed because of technology. But what about the rest of healthcare? Now, the problem number one in our country is getting a diagnosis. If you don't have a diagnosis, you don't have treatment. So if you're a startup out there, you're a medtech company, how can we improve a diagnosis for a patient? Because once you have a diagnosis, if you know a patient has diabetes, you can treat it. If you know he's got cancer, you can treat it. But if you don't have a diagnosis, you can't even begin to talk about treatment. Now, how in India do a lot of patients get a diagnosis? This is how. I mean, they get on a train, they take themselves, they get on a bullock cart, they take themselves and they go to a medical center with their scans to get a diagnosis. Now, if you look at something like my field, I'm a pediatric cardiologist. We have 1.2 billion people in India. 1% of every child born will have heart disease. So that means you're talking about 1.2 million children born per year with heart disease. We train about 20 pediatric cardiologists a year in this country, 20. That means about 300-400 pediatric cardiologists in the country. You've got about 50 cardiac centers that deal with children. They can deal with maybe 1,000 operations, a month. Maybe they can see 5,000 outpatients. So you can't even scratch the surface of getting to those children with heart disease, that 1.2 million who are scattered across the country. Now, if they can't have a diagnosis, they don't even know if they need to go to a cardiac center to try and get intervention. And that's where something like tele comes in. So this is an example of live telecardiology. So you see the echo is being done and you've got a cardiologist at the other end viewing the echo. Now this is about 15 years old. So this was the kind of telecardiology that was being done, where the technologist or the someone at the other end is doing it, and then the cardiologist is remote and reviewing it. Now this obviously a doctor is going to take 45 minutes to look at one patient's echo. So today the technologies have evolved. You've got record and store, and then the cardiologist can review it on his own time. And so today this tele-echo and telecardiology will enable a kid anywhere in India who can get an echo to get the opinion of a pediatric cardiologist. Similarly in radiology. Now, if you've got scanners, but you don't have a specialized doc who can report that CT scan or that X-ray or that MRI, there's no point doing the X-ray if nobody knows what the X-ray is showing. And that's again where technology has come in, and teleradiology, transferring it from the CT scanner to a doctor wherever he may be. So one doctor can cover many hospitals. And I think that's what tech has enabled, like it did in teaching, where one doctor can teach many medical students or many postgraduates. Similarly, when you use telediagnostics, one doctor sitting in Bangalore can cover 50 hospitals across India as a scan comes in from each hospital. And that has been really the huge enabler of teleradiology. This also makes it cost effective because that doctor, he's not sitting there waiting, having a chai while the next scan is coming. He's able to report for many centers at the same time. So it becomes a very efficient model and therefore a little lower cost model, which really gives access to remote areas. Now, AI and deep learning you would have all heard about it. There are today several startups in India in the AI and radiology space. And I think this is still an evolving field. So there's a lot of work that's still to be done. If I can give you an example, in 2016, this was the headlines. Can AI replace human doctors? And most doctors say no. 1 year later, 2017, they said doctors who use AI will replace doctors who don't. So you can see how quickly in 1 year things have changed. 5 years later today, in 2022, AI, so for instance, this image up here is in our ER workflow, where you can see a very tiny bleed that the AI algorithm has picked up. So 5 years later, while AI is not yet widely spread in healthcare, there has been advances. There are algorithms out there. There's been a lot of funding in this space, and there is now deployments that are happening where AI is helping diagnosis, because 20 million radiology reports, 20 million, ladies and gentlemen, radiology reports per year worldwide have inaccuracies, have errors. And that is where tech and AI will play a big role in really enabling the error rate to come down, to be able to help doctors become more, accurate in their diagnosis. Now, there are other areas of telediagnostics. For instance, teleophthalmology. You can do fundus screening remotely. You don't have a pathologist. Today, we have telepathology. This is another area where there's more work that can be done for little lower cost telepathology systems with high accuracy. Like how do you, if you have a smear, how do you ensure that the whole smear is covered, that you're not missing a part of it when you're transmitting? So there's still a lot of detail and a lot of things to be worked through in telepathology, therefore a lot of opportunity. Now I'll move on to the second problem. Okay, you've got a diagnosis. Now you want to get a doctor. How do you get the doctor? Of course, you're in a city, you go to a clinic or a hospital. If you're a bit remote, one solution has been telemedicine. Now, telemedicine is not new. 20 years ago, ISRO started working on telemedicine. They set up telemedicine centers across India, and they enable doctor-to-doctor consults or doctor-to-nurse, right? And the tele of 20 years ago was especially useful for remote and rural India. So this telemedicine sort of went on for about, a whole decade. But today, that telemedicine is completely changed. So what's new in telemedicine today? One, it's no longer just talking to the patient. The telemedicine of 20 years ago was essentially a video conferencing unit. It was a doctor there and a doctor here, or a nurse there and a doctor here talking, the doctor at the other end or the nurse at the other end taking all the blood pressure, ECG, the temperature, and telling the other doctor what the issue was. But the telemedicine of today is very data driven. You've got digital stethoscopes. You can listen for murmurs. You've got digital BPs. You can get the blood pressure. You have digital otoscopes. You can look in the patient's ear. You've got digital ECGs. You can get that ECG, look at it, see if the patient's having a heart attack, and then decide on what treatment to give. So a lot has changed with telemedicine, where it's not just about video conferencing. It's about video conferencing with data. So, apart from maybe feeling the abdomen of the patient, you can really do everything with the telemedicine of today. Now, the telemedicine of 20 years ago was for rural areas, right? But the telemedicine of today, why just rural areas? This is Bangalore. It's, traffic. You can't get to a doctor. Sometimes it's going to take you 2 days. 2 hours. 2 days would be a bit much. So I think telemedicine of today is not just for rural areas. You've got home monitoring. You've got telemedicine apps. So if you look at today, continuous glucose monitoring, there are several startups in this area globally as well as in India. So diabetes is much better controlled because the patient has this continuous glucose monitoring and they're in touch with their doctor through the apps. Everything's getting monitored. There are alerts coming out of the blood sugars too high. Look at your iPhone of today, right? You can get your heart rate on it. You can get so many things today on your wearable apps. Of course, it may be a bit of an overload for the doc. I can tell you I have patients, sending me all kinds of beeps and alerts from their monitoring systems. But the fact is it's available today. So home monitoring, that ease of, having checkup, sort of a lot of self checks at home, and then being in touch with your doctor remotely is really only been enabled by technology. The same applies for ICUs. If you think about ICUs, they need 24/7 intensive care specialists. Now, how many do we have in our country? Huge shortage. So today you've got tele ICUs and virtual ICU monitoring, where you can have one intensivist sitting exactly like this, looking at screens from the ICU. And of course, there needs to be a trained nurse, a trained person on the ground who can, say, intubate the patient or give a medicine. But this one intensivist can monitor many ICUs all at once. So again, you've got efficiency of utilization of your intensive care doc, and they can then direct appropriate care down at the hospital and ICU level. So it's become very much just the way work from home has become hybrid. Today, I think medical care, thanks to technology, is also very much hybrid, where you have some doctors and some care on site and some doctors off site. and all of this enabled by tech. Now, I think one area where tech has really made a difference, I mean, if you look at the statistics in India in mental health, they say that we have the highest rates of depression in the world. And it's a real growing issue. And I think, the COVID pandemic has worsened it. But tech has enabled help, has enabled patients, people to access health. And really that's because of privacy. There's been, huge stigma of going to a hospital or going to a clinic to see a doc. And, being able to do telecounseling from your own home, you lock the door, you get on your computer, nobody need, you can see a counselor. You're sitting in Chhattisgarh and you see a counselor in Bangalore. You're never going to meet at the grocery store. You don't have to worry about bumping into that doctor. So I think technology has truly enabled people to seek help for their mental care needs. And this has been a giant change in the last 4 to 5 years. I think 4 5 years ago, it was about, okay, can we use technology? Today, it's yes, we can use technology. How best can we use it? How can we get more counselors? There are only 2,000 counselors in the country. How can we increase supply so there's not such a shortage? So, at least the questions and the answers are in a different realm. It's not about can we do telecounseling? It's about, hey, how can we do this better? How can we get more manpower? How can we scale this up? And I think this, I would say, has been a huge value addition for the medical practitioners as well as for people, across the country and world. Now, there is finally, in terms of what has changed, and it may sound like everything I'm telling you is, oh, I knew this, right? I know that a doctor can see a patient. I know that you can give a diagnosis by tele, but this is only 2.5 years old in our country. So it is only on March 25th, 2020, when the pandemic hit, that the Ministry of Health of India actually legalized telemedicine. So believe it or not, before March 25th, 2020, you couldn't actually get a legal teleconsult in our country. So a lot of the activity which startups or anyone may have done in terms of telemedicine apps and technologies couldn't really be used because it was so ambiguous. And I think the only thing was happening was a bit of telecounseling, because that's not a doctor. That's like a counselor. Some teleradiology was happening because that came some under the IT Act. Um, but actual teleconsults that we're talking about were in a very gray zone and not legalized in India. So it took a pandemic, it took that little virus to make a huge change for technology and healthcare in our country. And I think now that those guidelines are there, telemedicine is legal, can be done. It opens up a lot of opportunities for companies to enter this space. Opens up a lot of opportunities for patients to be able to access good medical care anywhere across the country. And so I think this really, if you were to say one big change in the last 3 years, it's been this, the fact that the legal areas, the gray, and there is a whole sort of document on what constitutes telemedicine. Like, for instance, if I talk as a doctor to a patient, is that telemedicine? Yes, that's telemedicine. If a patient emails me and I reply, that's telemedicine. So can I do a teleconsult as the first consultation? Because earlier we only talked about, follow-up. Yes, you can do teleconsultation as the first. So a lot of those legal sort of gray things, I don't know how to do this, therefore I'm not going to embark on this. All that has been clarified in the last 2.5 years. And so it's really a wide open field for now anyone wanting to enter into the telehealth space. So I think I'll end with that, innovative use of technology such as teleradiology, telemedicine, telemonitoring, telecounseling, teleteaching can really help spread the reach of healthcare. Yeah, and I think that's where product companies, people working in the space of either technology development or technology plus service. Because I believe that today for healthcare tech to work, it really has to be a solution. it's while one can sell products, ideally if they're sort of integrated with good services, then it's much easier for the end user to kind of be able to do both together. But there's a space for both. There's a space for good health tech product companies, a space for good service delivery providers. I mean, you may service one state of the country, you may service the whole country, you may service a district of the country. There's plenty of opportunity today for people to scale and expand in the healthcare tech space and expand out of the geographies that they were in. For instance, sitting in Bangalore today, we are able to cover hospitals and diagnostic centers in Arunachal Pradesh and Chhattisgarh. So it sort of expands your reach. So I think, to everyone out there working on this, there's a lot that's been done, but there's a lot more that needs to be done and a lot more that can be done. Thank you very much.